Hemostasis is the process by which we stop bleeding. Platelets is part of hemostasis. Hemostasis have 3 steps, and platelets play a role, but it's only one of the steps in hemostasis. So let's take a look at the platelets. We have in the bone marrow stem cell, different set of steps. We are going to get a cell called a megakaryocyte. A megakaryocyte is a big cell, and this cell is going to break into pieces, and the pieces are going to be the platelets. Imagine that the megakaryocyte is a cookie. The platelets will be cookie crumbs. Okay, so let's take a look at the characteristics of a platelet. And as you can see, it's these big cells right here. This is a megakaryocyte, and these ones right here are going to be the platelets. As you can see, the megakaryocytes have a whole bunch of cell organelles. It has granules. You can see again megakaryocyte, and then you see the platelets. So what's the function of the platelets? The platelets are going to form something called the platelet plug. Not only that, the platelets are going to secrete some chemicals that are going to produce vasoconstriction in the blood vessel. Another very important function is that the platelets also produce clotting factors, which are very important because they produce coagulation. Other functions, such as, for example, release chemicals that dissolve the blood clot once the blood vessel that is cut is already healed. Platelet production, we said that the platelet production happens at the level of the bone marrow by a process called thrombopoiesis. Next, hemostasis. We said hemostasis has 3 steps. Vascular spasm is step number 1. Vascular spasm or vasoconstriction is the same thing. Platelet plug formation is number 2. And blood clotting or coagulation is step number 3. As we mentioned before, the platelets play an important role in all 3. Step number 1, we said vascular spasm. That's the step in which the muscle available in the blood vessels are going to produce vasoconstriction. Platelet plug formation. When the blood vessel gets damaged, areas inside the blood vessel are going to be exposed. When they get exposed, collagen is going to get exposed. And this collagen is the one that is going to trigger the addition, the attachment of the platelets to the walls of the blood vessel. Very important step is the presence of a substance called von Willebrand factor. Von Willebrand factor is like a glue that will help these platelets attach to the blood vessel to initiate the platelet plug. So once you have the platelets and the platelets start attaching to the blood vessel, the platelets are going to start releasing some chemicals by a process called degranulation, as you can see here. The platelets are going to release, for example, serotonin. Serotonin also will produce more vasoconstriction. It also has ADP. ADP will attract more platelets to the area that was damaged. And also thromboxane A2, which will promote platelet aggregation, which is the attachment of more platelets to the initial set of platelets that were attached to the blood vessel. The platelet plug is not very strong. So let's take a look what happens after you form the platelet plug. In this case, we're going to look at the steps of coagulation. Coagulation is achieved because in your blood you have coagulating factors. These coagulating factors get activated 2 ways. One way is the intrinsic mechanism, and the other one is the extrinsic mechanism. It's called intrinsic mechanism because it uses the clotting factors available in your blood. The other one is called extrinsic because the blood vessel opens. So factors in your blood vessels, after they get broken, initiate the coagulation. So that means that there are times in which your blood vessel is not damaged, but since we have coagulating factors in the blood itself, you can initiate coagulation even though you are not bleeding, or at least you're not seeing the blood coming out of your body. So let's take a look now at how we are going to use this mechanism. So you have extrinsic and intrinsic. Now there are multiple different factors, and these factors are activated in sequence, as you can see right here. One very important thing that you need to know is that the end result of the coagulation is that after you activate all these factors, you will activate thrombin, and thrombin will activate fibrin. The fibrin are going to be the fibers that will make this wall very strong. So you have the platelets, which are going to make the wall, and you have the cement that is going to be the fibrin. So the bottom line of all this is that you will activate thrombin, and thrombin will activate fibrin. The fibrin are going to be fibers that eventually are going to produce this very strong mesh that we have in there that will help us stop bleeding. Completion of coagulation. After you activate all the clotting factors, at the very end, you're going to have thrombin. And thrombin will activate fibrin, and with that, we're going to end coagulation. Intrinsic and extrinsic factor, one thing that you should be aware of is that they need calcium in order to make it work. So as you can see here, calcium is very important on that. All these coagulating factors are going to create this process of coagulation. And at the very end is just to create thrombin, and thrombin eventually is going to create fibrin. How long does it take in order to coagulate? As you can see here, for example, bleeding of a fingertip, then it should stop in 2-3 minutes. The clotting factors. So as you can see, you have the number of the clotting factor, the name of the clotting factor, and where they come from. So as you can see, most of them come from the liver, but at the bottom, you're going to see the other clotting factors. They come actually from platelets. So what happens with the blood clot? Once you create a blood clot and it's strong and it stops us from bleeding, then the area of the blood vessel that was damaged needs to get repaired. For that reason, the platelets as well as the cells in your blood vessels are going to release something called platelet-derived growth factor. Why? Because they will stimulate the fibroblasts as well as the smooth muscle cells in your blood vessels to multiply and repair the damage that happened in the blood vessel. Eventually, you are going to repair the area that was damaged. So once that happens, you have to get rid of the blood clot. The destruction of the blood clot is called fibrinolysis. So how do you destroy the blood clot? In order to destroy the blood clot by this process, you need to know two steps: kallikrein and plasmin. So if we look at the steps of destroying the blood clot, right here you have kallikrein, and kallikrein eventually is going to create plasmin, and plasmin is the one that is going to destroy the blood clot. Prevention of inappropriate clotting. After coagulation starts to make the blood clot very hard, how come this does not continue? How come you don't create a bigger and bigger and bigger blood clot? There's a few factors. Platelet repulsion. The first step is to create a platelet plug. In order for you to create a platelet plug, the platelet must be attached to the damaged blood vessel. However, the blood vessel is very smooth, making for the platelet very hard to attach to it. In addition to that, the blood vessel is going to release prostacyclin. Prostacyclin is a substance that is produced by the blood vessel that avoids the platelet to be attached to the blood vessel. Dilution. If we talk about the intrinsic mechanism, that means that you can create thrombin because you don't need the blood vessel to get damaged. So in normal circumstances in your body, certain amount of thrombin gets produced, but we have so much blood and the blood flows so fast that it doesn't allow the thrombin to actually create very big blood clots. Anticoagulants. Thrombin is the one that is going to initiate the formation of fibrin. However, we have anticoagulants. There's one anticoagulant called antithrombin that is produced by the liver. Obviously, antithrombin will stop the production of fibrin, therefore fibrin will not be able to produce a blood clot. You also have heparin. Heparin is produced and released by the basophils. Heparin is also another anticoagulant. So these three are the mechanisms that we are going to use in order to stop blood clotting when it's not supposed to happen. And then after that, we have clotting disorders. There's multiple different kinds of clotting disorders, such as hemophilia, for example. Also, the liver produces many coagulating factors. So any disease affecting the liver will affect the coagulating factors. Many clotting factors need vitamin K in order to be created. And vitamin K need bile from the gallbladder to get absorbed.